Good afternoon and welcome to our Healthy Northeast Ohio Regional Convening, everybody. We are really excited for today's event. And the last time we came together for our regional convening was back in February, which is really hard to believe. It feels like it's been a very fast year. So we're just really looking forward to getting into our agenda today. And we thank you again for your attendance. My name is Libby McGraw. I know we have a lot of familiar faces, and so we'll make our introductions very brief. But I'm the Regional Community Health Improvement Manager for Healthy Northeast Ohio, and I'm based at the Center for Health Affairs in Cleveland, and I'm one of our local site administrators for healthyneo.org. And Sarah, would you introduce yourself?
Thanks, Libby. Hi, everyone. Good afternoon. Thanks so much for being here. My name is Sarah Zabo. I work at the Cuyahoga County Board of Health, where I'm a data analyst, and I serve as the website administrator for Healthy Northeast Ohio.
Thanks, Sarah. We are going to go ahead and take a brief pause, and so I'll stop sharing. We know we don't necessarily have time for introductions for everybody who's on today's call, but we would like to get a little bit of a sense and give our guest speaker today a sense of who is in the group. So we'll do a brief roll call of our whole Healthy Northeast Ohio region. So we'll just go county by county just to see who's on today. And so if you wouldn't mind, if your camera on, you can just raise your hand and wave at us so that we know which county you're representing, or if your camera off and you just want to use one of the functions for Teams in the toolbar at the top of your screen, that'd be great. So we'll just go county by county. So we'll do our quick roll call. I think we did this last time, so it was great to see who all had joined. So we'll start with Ashland County. I know I see Vicki. Hi, Vicki. Anybody else from Ashland? Great. And then Ashtabula County. Hi, Jennifer. It's good to see you guys. Cuyahoga County. We have a couple Cuyahoga County folks. Geauga County. Do we have anybody from Geauga today representing Geauga? Okay. Lake County. Hi, Joe. Lorain County. I see Andrea is on my screen. Medina County. I thought I saw Krista earlier and maybe Kristen too. Hi.
Hi.
Portage County. I think I saw Joe on. Hi, Joe. Good afternoon, everyone. And then Summit County. Hi, everyone. Hi, Corey. Great. Okay, we'll reshare our slides and we will get into our agenda. Sarah, can you confirm if you're seeing my slides?
Yes.
Okay, thanks so much. Great. We do have a very brief agenda that we want to review. We are going to go through some of our Healthy Northeast Ohio updates, and we do have quite a few of them, but they should be pretty quick. We did request just very brief updates from many of our partners today about your current community health activities, whether that be pertaining to your needs assessments or community health improvement plans, or even if there's just community health efforts you'd like others in the region to know about. We did want to give everybody some time for that. And then we will move into our guest speaker, and we are very excited to have Carrie Almessi join us from the Health Policy Institute of Ohio. Sarah and I got a very sneak peek of her slides, and we think it's going to be really interesting, and I think you're all going to really enjoy her session. And then we will go ahead and wrap up. So moving right along, we do want to just remind you of our purpose. This is something we came up with a couple of regional convenings ago. So again, just to remind everybody that the purpose of these is to convene partners across the 9-county Healthy Northeast Ohio region to drive community health improvement efforts through collective impact. And moving into just some background information, I'm going to keep this very brief as well. I know that that most of you who are on the call are familiar with our mission and with who we are, but for anybody who might be newer, healthyneo.org, we did launch. We're coming up on our 4-year anniversary, so it's been an exciting 4 years, and everybody in our service area across the 9 counties, we just are so appreciative of your continued support. And then, of course, we do continue to be supported by a grant through the HealthCom Foundation here in Cleveland and through many partner contributions from a lot of those who are on today's call. And to give you a sense of who all of our partners are, here we have everybody's logos. And with that, we'll just move on to some of our overview information too about how Healthy Northeast Ohio can be effective in understanding and exploring the needs of a community. Of course, if you're familiar with our website, data can be visualized in very dynamic ways. Priorities can be You can prioritize health needs through the website and utilize it for that as a resource. And then all of those things can assist, hopefully, our partners and support them with taking action in their own communities. And so here you see just some of those ways in which we know Healthy Northeast Ohio can be effective and effectively support our community health partners. So we are going to make one brief ask. And for those of you who might have joined us back in August for our webinar about utilizing Healthy Northeast Ohio for grant proposals, we did launch a survey about website satisfaction. And we are just really looking for some great feedback about how you're utilizing healthyneo.org. So Sarah, I believe, is going to add that link to the chat. Thanks so much, Sarah. And we will keep that open through today as well. So this is just our quick call to action for that. And with that, Sarah, I'm going to turn it over to you for some of the site updates.
All right, thanks, Libby. Okay, so again, these will be pretty brief, but we did have some site updates and enhancements that we wanted to share that we've made for sure since our last regional convening. So again, just more recent updates. So we'll just touch upon some of our county page updates, some data updates, talk about our progress tracker, and then some of our how-to resources. So next slide, Libby. Perfect. So again, we did make our annual updates to the county specific web pages on the site, and those can all be found in the Explore by County tab that you can kind of see highlighted at the top of the screenshot. But you will see that the county health rankings and roadmaps, both the rankings and then links that we included, have been updated to reflect the 2023 rankings that were released. So these health outcomes and health factors rankings can be found towards the top of each of the county pages. So we encourage you to check those out next time you're on those pages. Next slide. Thanks, Libby. We also updated the county demographic profiles that are on each of the county pages with the 2023 demographic data that is now available on the platform. And these are just one-page PDF profiles that we created that include some select demographic variables like population size, population by race, ethnicity, sex, age, etc. for each of our counties. So those are available to you there. And then the data scoring tool reports that are also found on this page towards the right. We also updated those for each of our counties. We ran them, I think it was like late spring this year. And just as a quick reminder, the data scoring tool provides a systematic ranking of a county's indicators to help with setting priorities for community health improvement. And in addition to the report, you can also view a methodology document on each of the county pages just to learn a little bit more about that tool. Hit the next slide. Okay. And, as I shared, we also wanted to share just several data specific updates with everyone. So just like the county demographic profiles that we have, the regional demographics profile was also updated with 2023 demographic data for the region. And this profile, which is in like a story format where you could kind of click through chapters and pages, allows you to view demographics for each county within our region, but all in one spot, rather than having to go to our demographics dashboard and look up each county individually. So this profile can be accessed both in our Explore data and our Explore by County tabs on the platform. Thanks, Libby. The Cuyahoga County Childhood Lead Poisoning Dashboard, it has been available on the platform for several years, but we do update it annually. So now you'll see that it does include 2021 data. And this data is available at a variety of geographic levels for Cuyahoga County. For example, it goes down to the census tract level and also includes data by the Cleveland neighborhoods. Thanks, Libby. And there are also two new curated dashboards that we just wanted to kind of call out today to draw your attention to. So the first is the High School Youth Risk Behavior Survey, or YRBS dashboard. And if you're not familiar, the YRBS is conducted nationally and it monitors health behaviors and the experiences of students. So this dashboard includes select indicators, again, from the high school YRBS for the state of Ohio and then for the city of Cleveland. And once you get into it, you'll see that there is subgroup data available by gender, race, ethnicity, and sexual identity, just depending on which location you select. And then the second new curated dashboard that we're excited to share with you is the Healthy Aging Indicators Dashboard. And this includes indicators that can be used by organizations who engage in community health improvement efforts to further their understanding of healthy aging, and then also to measure population level health status related to aging. So this dashboard includes indicators related to health behaviors, health outcomes, and social determinants of health, and there's quite a few indicators in it. And I also wanted to kind of call out, if you are looking for data specific to the Medicare population, there are about 20 or so indicators available. And then wanted to share that we did reference a guide called The Indicators of Healthy Aging, a guide to explore healthy aging data through community health improvement. And this was, I think, fairly recently released from Trust for America's Health, and then also the National Association of County and City Health Officials, or NACCHO. So we did use that when selecting the indicators to include in this dashboard. And if you go to the dashboard, towards the top, you'll see that there is a link if you wanted to check out that guide on your own. I think next slide, please. Thank you. Okay. So we also wanted to just briefly mention that there are two files that can be found on the search for data page that have been updated. The first is the Healthy Northeast Ohio Data Sources graphic. And that's just a one pager that lists all of the data sources that the 300 plus indicators on the site come from. So again, we do try to update that annually, so you can check that out. And then the second file we wanted to draw your attention to is the indicators overview file. So this includes details about each of the indicators on the site. For example, any technical notes that might be available, what measurement periods are available, and then any breakout data availability, just as a few examples. So the next time you're on that page, you can just click on those and they're hyperlinked to view more information. Next slide, please. All right, and I saw Vicki on the call, so we're really excited to share that we did collaborate with the Ashland County Health Department to create and launch the Ashland County CHIP Progress Tracker. So this is like a web page that's on the site that you can find in the Explore by County tab. And again, just a big thank you to Vicki Taylor for her collaboration on this page. We were really excited to see it actually come to life. So just as a quick refresher, if you're not familiar, the progress tracker, that's a tool that Libby and I have access to in the back end of the site that can be used to create these custom pages to visually display progress related to priority areas or goals from community health improvement plans or implementation strategies. I know you're not seeing it here because we're just showing a static screenshot, but the progress tracker does allow you to add checklists. So you can show a status. So for example, not started, in progress, or complete. You can also include graphs and any custom content to show progress again on those goals, objectives, or strategies. And that data does not need to be associated necessarily with indicators on the Healthy Northeast Ohio site. So you'll see some examples of that on the Ashland County CHIP Progress Tracker. And then if you have any interest in creating one of these for your county, I would just encourage you to reach out to Libby and I for more information. And I think, Libby, I'm turning it over to you for our last updates.
Yes. Thanks so much, Sarah. And these last two will be very brief. And just a reminder, we do have a pretty extensive how to use the site page on Healthy Northeast Ohio. And if you do visit that page, we have a website user guide, and that's a very thorough walkthrough, step-by-step instructions on how to use a lot of the features. And in addition to that, we do have a series of video tutorials. These are all very brief. I think the longest one is maybe 7 minutes. So just as a good quick reference. And those are the rest of our website updates. So we are going to move right into our partner sharing. And I did touch base with a couple of you on the call today, and I know some people have other meetings. Again, we are so appreciative of your time. We know it's such a busy time of year. So for those who did have time constraints, we'll not necessarily go in alphabetical order just so that we can accommodate everybody. So we will move right into that partner sharing. So first up, Jennifer from Ashtabula County. I'll go ahead and call on you for any brief updates you'd like to share with the group.
Okay, thank you. Can you hear me okay?
Yes, I can hear you.
Okay. Um, right now we are working on, or I am working on our annual report for the CHIP. We do a quarterly survey that I send out to the leads of the strategies, and it's pretty, not too lengthy, but it does get into the meat of things a little bit, so that I can kind of pull not just the progress, but get a feel for differing items, and then that helps me write the annual report, which I'll be doing after the fourth quarter report from the teams. Our access to care report is done, and that's going to be up on our website. Also, those quarterly surveys and reports are also on our website under administration tab. And yeah, we have a volunteer webmaster who's working on our Healthy Ashtabula County site. So that'll be great to be able to, store things there and interact with people from there. But that's about it. We just keep moving. Thank you.
Thank you, Jennifer. Thanks so much. Great. Okay, next up we'll have Vicki from Ashland County.
Can you allow me to share my screen?
Oh, yes. Let me go in and I'll go ahead and give you that permission. Give me one moment. Okay.
There it is. All right. And I'm going to I don't see the screen I should be sharing. Share my screen. You're probably not seeing the right screen.
I'm seeing your probably your desktop. Yep.
Yeah.
Okay. Let me see if I can fix that. Stop sharing. Share. This is the problem with having multiple monitors. There it is. Okay. Now you can see it. Are you seeing clear impact now? Okay.
Yes.
Perfect. I'm gonna turn my video off. So we keep track of all of our information from our chip and clear impact, which I just want to let you know everybody in Ohio has access to this for free. And so recently I could see that Healthy Northeast Ohio had updated some of the numbers that we are tracking. So for instance, the colorectal cancer rate cases have gone down since we first started this last quarter. And then lung cancer and bronchial cancer rates have gone down. So I just pull those numbers right off the Healthy Northeast Ohio site and put them into my my screen for clear impact, and that's how we're able to kind of keep track of our data. This is not the data that is internal things like our events or things like that, but mostly just our data points that we are pulling from Healthy Northeast Ohio. I will say this, and I'll just give you a plug because they know me, both Sarah and Libby know me very well. Being a very small county, I am so pleased to be able to have access to data like this. And this has been a struggle for us to find county-specific data in a lot of data sets, especially for our, not being one of the big cities. So having this data available has really changed the way that we're doing business here at the health department. So I appreciate having access to this, that we can prove that we're making data-driven decisions and that we have access to the data. So thank you for allowing me to present. today.
Thank you, Vicky. And I am going to just take back over with the screen sharing here.
Thank you, because I was trying to find it.
No problem. No problem. Okay, we'll move on to Lake County. I think we have Joe.
Hi, yeah, good afternoon, everybody. So just a couple updates with our, excuse me, Cha and Chip. So for the for the needs assessments updates, both of these are on our website. But we did add an addendum for East Lake that covers mental health and food insecurity that were both identified in our needs assessments, and that was done through interviews and focus groups with like administrators from the school system there, the mayor, again, because I know I did a couple. I didn't actually write up the addendum, but again, that's on our website if anybody's interested. And we have also done to date 3 what we call data deep dives that are geographic disparities by census tract so far. We'll probably move into zip codes in the near future, and these are for key health indicators. So far, we've done binge drinking, stroke, and hypertension. All of that comes from Healthy Northeast Ohio for Lake County. Again, that's available on our website. And for the CHIP updates, our partners are currently working on strategies for that. And we've also had recent success with implementing a story walk trail at the municipal park in Paynesville. So that is in partnership with Morley Library, which is the library in Paynesville, friends at Morley Library, and one of the Boy Scout troops. That opened on August 30th, 2023. So that does it for our Lake County updates.
Great. Thank you, Joe. Okay, let me get back to my list here. Okay, and for Cuyahoga County, Sarah, I think you're going to actually do the Cuyahoga County update.
Yes. Thank you, Libby. I do have a brief CHIP update I'm sharing on behalf of other Cuyahoga County Board of Health staff who aren't able to attend today due to conflicts. But first, I wanted to share that Renee Rafali has transitioned from CCBH. So her role of coordinating and facilitating the CHIP process is transitioning to Nichelle Shaw, who is a supervisor in our population health department. So just wanted to share that. And I know Nichelle and others, they're currently assessing where we're at in the CHIP process, beginning with the priority subcommittees. And in Cuyahoga County, those are eliminating structural racism, behavioral health, which includes both mental health and drug use and misuse, accessible and affordable health care, access to healthy food, and community safety. The priority subcommittees did have kickoff meetings, and the structural racism subcommittee has had some subsequent meetings as well. And then currently the infrastructure for those subcommittees is being refined, and leadership is still being established, I think, for at least one of those subcommittees. And then in preparation for 2024, that's begun, and that'll include providing support and guidance to those subcommittees as it relates to developing and implementing work plans, tracking activities and outcomes, and then also reporting out on outcomes. And that's my update. Thanks, Libby.
Thanks, Sarah. Okay, great. For Lorain County, I think I saw Andrea was on, and maybe Kat, you were on too. So whichever one of you would like to provide an update, that'd be great. If you would like to provide an update.
Yeah, thanks for the invitation. For Lorain County, our successes are similar to everyone else's. Our partners are working on the strategies, but we did want to share a challenge. We were kind of wondering if other people were facing as well. So during this CHIP cycle, we are asking hospital systems for data, and we've been working on this specifically for about a year. We do have a great connection with people at the hospitals. We're talking about it constantly, and yet we still don't have the results we're looking for or hoping for. And a lot of times, like, the roadblocks are just big because we're just little old Lorain County, and the hospital systems cover the region actually. So we were wondering, one, if anyone has been able to face this challenge and overcome it, and two, maybe if not, maybe as a group of regional partners, we can talk about what solutions could look like for responsible data sharing methods with the hospitals.
I'll just come off mute for a moment. I think others should have the opportunity to unmute themselves if they'd like. And if you also want to use the chat function too, if that's more comfortable, that'd be great.
I will.
Thanks, Andrea.
I'm sorry, this is Vicki from Ashland. I would concur. We have the same issue. Getting hospital direct data has been almost impossible. And when we've asked, they're like, we don't even get it locally. So they couldn't even pull locally. So I would love for us as a group, because we probably share some of the same hospital systems, if we could work together and figure out how we could get specific information just for our regions. Yeah.
This is Summit County. I would concur as well. I mean, I've been fighting this battle for 14 years, so it's been tough to get the data from the hospital systems. We're fortunate enough, like one of our local hospital systems is just Summit County only, Suma Health, and we actually write their CHA for them. They contract us to do it. But even with that said, they depend on our data as opposed to giving us the data. So it's definitely been a very, very hard challenge for us as well.
Hi, this is Joe with Lake County. So we here in Lake County have like 2 main hospitals, and right now, I guess we've also kind of had those challenges in the past. I'm still fairly new here. I've been here for a little bit over a year now. But what I will say is that our health commissioner, we're actually kind of tapping into his network. So I think within the next, I want to say like in December and maybe at the beginning of January, myself, the health commissioner, and maybe my supervisor actually having like meetings with this contact of the health commissioner. So hopefully that kind of gets us tapped into their data systems and being able to come to some sort of like data agreement with them. So we'll see. So maybe like the next regional meeting that we have, I'll have a little bit more to say. But so far, that's kind of how like our approach to it is.
And
And
Libby, I can
go
chime
ahead,
in.
Sarah.
Oh,
Yeah, I was going to say, Sarah, if you want to chime in, and then I'll kind of
sure.
bring it back.
No, I was gonna say, Andrea, great question. Thanks for bringing it up, and thanks for everyone for chiming in. I was just gonna share that for the purposes, like with my Healthy Northeast Ohio hat. With the platform, one of our initial goals was to integrate data from the Ohio Hospital Association, but similarly to the feedback that everyone else is sharing, that ended up leading to sort of a dead end, which we've tried to revive a few times. So don't have any solutions necessarily, but just sharing that it's definitely, I think, an issue that many of us probably are experiencing.
Mm-hmm.
I
No,
will share
and
one
thanks.
success
Oh,
that
go
I
ahead,
know
Carrie.
of real quick. I know that there has been success between the Greater Dayton Area Hospital Association and Montgomery County in being able to share some data. So I don't know if you've worked at all like with the Center for Health Affairs, but I think sometimes regional hospital associations are easier to work with than OHA in like getting and sharing some of that data.
And I know this is something, and I'll just chime in as well. I think this is something that, like Sarah mentioned, we were aware of some of the barriers, but having this group regionally, I think that this could be a really great opportunity for us to maybe come together. And I don't think we're going to have another regional convening before the end of this year, but perhaps early next year, we could even focus on bringing in somebody from that Dayton area, like you just mentioned, Carrie, or finding some of those opportunities to really investigate that. I know I definitely hear everybody. So thanks so much for bringing that up, Andrea. And
Yeah,
just for the sake of time, I want to make sure we can continue on with our other updates. So did Lorraine have anything else you guys wanted to share? Even though this is a great conversation, I definitely don't want it to stop.
I guess like to end on a happier, successful note, like we the one entity, health system entity that is great, like clockwork at getting us data, is our FQHC, our Federally Qualified Health Center. So we get data from them on the first of every month. It's kind of magical. And we suspect it does have to do with the different regulations and things that they have to follow, but it is nice to get data from a healthcare system, even if it is like our small little FQHC.
Thanks so much, Andrea. Okay, we'll go ahead and move on to Portage County. I think we had Joe on, if he's still on here.
Okay.
Oh, I see. Yep.
All right. Thank you. So I just want to mention that we finished our community health improvement plan back in 22. So we actually had almost a full year now for the community health improvement plan once we got everything done in 22. So the community health assessment, the improvement plan, both were completed in 22 at the end of 22. So we are almost one full year into the community health improvement plan for us. One of the biggest barriers that we're seeing right now, or challenge, is with getting consistent data for tracking labor and delivery. We only have one hospital in Portage County, and that's UH Portage. They used to have labor and delivery, and they don't anymore. So we've actually been struggling trying to get consistent data for what's going on at the emergency department, transports with EMS, where our pregnant moms are actually delivering their babies because they got to go outside of the county now. So we're kind of struggling with that data, and we've been going back and forth with the hospital and some of the OBGYNs to try and gather that accurate information. One of the big successes that we've had this year has been related to chronic disease. So we've had a great collaboration between our farmer market vouchers and many of our bigger community partners, like our Women, Infants, and Children's program, SNAP benefits, Jobs and Family Services, UH Portage. So we've had a great collaboration with the farmers market over this past summer with many of our bigger agencies for the uptake of those vouchers. Secondly, with mental health and addiction, we're experiencing over this last year a movement towards mobile outreach for harm reduction. So I know some of you are a little bit bigger and you might have some mobile capabilities, but we're looking at launching into mobile outreach for harm reduction and mental health outreach, as well as health screenings, using our existing partners like Access Point, which is our federally qualified health center that serves both Portage and Summit County, but also Kent State University and Coleman Professional Services. So those are our successes for this year. We've kind of moved this whole year of 23 so far, we've moved all of our partner meetings, the community health improvement plan meetings, to in person. So we stopped doing any virtual meetings, and we've grown actually in attendance by requiring in-person meetings. We are getting spotty attendance for some of the quarterly meetings. So we stopped the virtual, and we've actually increased participation with in-person meetings. So we're happy about that. I think we all had a little fatigue with during COVID with all the virtual meetings. And we even heard that from some of our partners that they would prefer the in-person meetings. So we're glad to accommodate them, and we've seen an influx in our attendance for our quarterly meetings. So thank you for the opportunity to provide a quick update for us. Thank you.
Thanks so much. Thank you, Joe. And Medina, I don't want to skip over Medina. Kristen, I know you guys said you didn't have too many updates, but I do want to give you guys the opportunity if there was anything that came up for Medina.
Yeah, thanks. It's fairly similar. We're starting to use Clear Impact, and I'm happy to see that there's some YRBS data on the site. Tegan, our new epidemiologist, I think is also on. And then I saw that Krista put some information in the chat about a data work group that if folks didn't look in the chat, she's on and has some of that information, but she put some info in there. So we're plugging along some of the same challenges and still kind of rolling through it, hopefully kicking off a new chip early in 2024 for us.
Great. Thank you, Kristen. And then for Summit County, I know we had Corey on and David. So Corey, I think you just popped up on my screen. So I'll call on you.
Hi, everybody. Well, we released our community health assessment early last year, about 220 indicators. And then we just released our community health improvement plan in October, so about a month ago, and they're both available on our website. We're getting ready to hit our second reaccreditation in a month, so we're gearing up for that. I'm glad to have those major plans done. We are administering our local youth risk behavior survey right now to all of our school districts here in Summit County. It has been a fight this time around. We'll lose a school, I have to call and do whatever I can to get them back. It has been very, very difficult this time around, and I'm really worried about the next administration. I think we're going to have enough schools to get statistically valid data this time around, but it's going to be close. And so it's been very, very hard to keep these schools on board. I'm trying to think of what else. Joe, I'm glad you mentioned the in-person meetings. One of the challenges we've been having is pre-COVID, our Summit Coalition for Community Health Improvement, which is our community coalition that drives both the CHA and the CHIP, were super strong, great attendance. And, ever since coming back from COVID, virtual, even in person, we've been really struggling to keep people engaged. And then when they do come, it's just, especially virtually, the engagement is extremely low. So it doesn't need to be addressed at this call, but I'm just curious how people's engagements are. I still think it's pretty good overall, but it's definitely it's been hard to get it back to even near pre-COVID levels that we used to see. So, David, do you have anything to add that I missed?
No, you covered everything I was going to touch on. So,
okay. Thanks, everybody.
Thanks. Thank you, Corey. Great. And then we do have a couple of hospital system updates. And I know, Elizabeth, I think I did see that you joined. So if you would like to provide an update for Cleveland Clinic, and then we'll move on to Metro and University Hospitals.
Great, thank you. This is the fun part of hearing what we're all doing. It's just one thing when we're collecting data and doing the assessment. For me, it's just more fun to find out what we're all doing about it. So I'm just writing all kinds of notes. We're moving along and following similar patterns that everybody else is doing. Working on food insecurity is one of our top issues. We find that in our Ohio hospitals, and believe it or not, we're finding it in our Florida hospitals too. It's not just a regional thing. It's pretty much national. We're also really focused on our lead safety. We have incredible amount of lead issues in homes, apartments, and work of life and play in the city of Cleveland. So we are addressing that. We're working with UH on a variety of these topics, and also Metro Health. When we're talking about access, we're working with the Unite Us, which is a dynamite program. Also working on the infant mortality. We have an infant mortality center, an official center now. We've hired a director and some community health workers, and we're working with First Year Cleveland and working on getting into the homes and really striving to get much more personal in that world of stopping those preterm deaths and issues in brown and Black communities, and seeming to be headed in a good direction. Just hearing the stories, not necessarily the data, because we know that takes a while, but the stories. So that's been good. I think the other piece is that we're continuing to look at that access, the digital equity. Getting internet not as fast as I think we want, but we're still working on that across the board, trying to find places and partners that will help us get everybody connected so we can have access to the internet. And then finally, just as an overall theme that we're really focusing on, because there's so many things you can do. I mean, we want to do everything. So we're really focused on taking that health equity as our first pass. Where are we needing those pieces instead of having maybe all 80,000 people in the community? Let's really focus on those zips or those census tracts that need it. So we're really taking the health equity focus when we're putting these strategies together. So we've been working with our counties, we've been working with our other hospitals, working with Center for Health Affairs. It's good. It's we're not there yet. I mean, it's taken decades for the problems to exist. It's going to take a little bit of time to address them. So I'm not fooling myself or anybody else, but I think the partnerships and the looking at a broader continuum and a broader collective pack is really making a difference. I'm thrilled. So thank you.
Thank you. Thanks, Elizabeth. And then Angela from Metro. I believe you're doing the Metro update, correct?
Yes, yes, yes.
Okay, thank you.
Okay, so Metro Health held this inaugural Multicultural Women's Health Fair and Empowerment Expo in September, and we had over 2,500 attendees. And planning is underway for a similar event in next year, as well as for the third Minority Men's Health Fair and the second annual series of Multicultural Children's Expos. In the area of food security, we continue to operate our food as medicine clinics and regular fresh produce distributions, which is on track to distribute the equivalent of more than 100,000 meals this year. We recently launched a program in partnership with Western Reserve Area Agency on Aging to identify and address the needs of seniors who are food insecure and at risk for malnutrition. We also recently started a SNAP text campaign in partnership with Greater Cleveland Food Bank, reaching out by text to patients who may be eligible but are not enrolled in SNAP food stamps. This was modeled after a similar project carried out by Kaiser. Regarding access to care, our school health program expanded this year, notably with the opening of the Cleveland Heights Wellness Center in partnership with Cleveland Heights University High School District and located at the Cleveland Heights High School. The center provides a range of primary care and wellness services for students, as well as district families and staff. Our community health team continues to provide regular access to primary care services throughout the community in mobile units that regularly visit homeless shelters and other locations where vulnerable populations gather. In the area of social isolation, and that's the area where I'm primarily responsible, we are continuing our efforts to connect CMHA residents to affordable Wi-Fi so that they can virtually visit family and friends. This partnership was launched last year in partnership with Digital C, with CMHA and Dollar Bank. The Center for Arts and Health uses the creative arts therapies and visual and performing arts programming to address social isolation. And programs were launched by art and music therapists at the Old Brooklyn campus and our Spry senior locations in Brook Park and Strongsville. Calls for Hope, a program matching trained volunteers for weekly chats with patients identified at high risk for social isolation. It was prominently featured in a half-hour special hosted by Dr. Amy Acton on the subject of loneliness and isolation recently on Channel 3 WKYC. It was an honor to meet her and to be part of that interview. It was wonderful. And finally, Blooms of Hope was launched as an initiative to reach out to our patients identified at high risk for social isolation with a gesture of kindness through repurposed bouquets of flowers delivered from Big Hearted Blooms to designated patients at our Spry senior facilities. So that pretty much sums up our high-level report.
That's great. Thank you so much, Angela.
You're
And
welcome.
then I believe last but not least, we have UH and Lena Grafton, I believe, is going to give us their update.
Hi there, Libby. Yes, hi, everyone. Thank you for inviting us. We are so very grateful to have you all on the team. And I will share that we have quite a few members of the UH team on the call. So I will lift up our teammate Odiri Omobian, and she'll give the brief update for University Hospitals.
Good afternoon, everyone, and thank you, Lena. I will keep our update brief. So as of last week, November 10th, we held our quarterly CHLC meeting, Community Health Leadership Council meeting, at our newly opened Bedford Wellness Center. Bedford Wellness Center opened on October 16th for just a soft launch of programming. And we will certainly be having a larger grand opening event into 2024. So we gathered our community outreach nurses, and we really just had a time for us to discuss different updates that are taking place in our respective markets and where UH has a footprint. We discussed food insecurity, and we've been working to address food insecurity through food distribution collaborations with our local wellness centers. Of course, we have our Food for Life markets as well. We talked about digital health in our efforts that we're making through digital health education and screening, our ACP Affordable Connectivity Program that our digital health coordinator here at UH, Tiana Williams, does a lot of work around, and really seeing how we can get that type of service into our more rural spaces, such as Ashtabula and Geauga County. And then we discussed Healthy NEO. We provided a walkthrough of the Healthy NEO website just to make sure that our community outreach nurses and our other colleagues in the community benefit community outreach space had an understanding of how to utilize the website and how to gather data in a more quick and efficient way. And then of course, being able to just discuss the different programming that's taking place within the system and just kind of coordinate how we can share that information more widely, both internally and externally. So I will pause there. Lena, is there anything else that you'd like to add?
I just wanted to share that our Wellness Center model, we had a ribbon cutting the beginning of this week. If any of you were able to see the news, our Glenville Wellness Center is up, open, and running. We have a Food for Life market there. We have our Bedford location, and our Richmond location will soon open in 2024. It's an opportunity for us to provide prevention type services. It has a learning kitchen. It has a multi-purpose room where we can have nutritional and health education type of classes. And we also have space to do physical activity, such as Zumba, line dancing, yoga, mindfulness, and those type of things. So more about that to come. We just completed our community health investment strategy plan. And it is lifting up 3 priorities, and that is maternal and child health, as well as well-being as you think about preventive services and workforce development. So I will stop there.
Thank you. Thanks, Lena and Odiri as well. Great. Okay. I love all the updates. I know all of you appreciate the updates too. So thanks to everybody who took the time to provide those for us. And we're going to move right into our guest speaker for today. And Sarah, I'll share my screen. And if you want to go ahead and introduce Carrie, that'd be great.
Okay, thanks again, like Libby said, for all of the updates from everyone, much appreciated. So next, I have the pleasure of introducing our guest speaker for today, Carrie Almasy, and she is the Director of Assessment and Planning at the Health Policy Institute of Ohio, or HPIO. So Carrie, I know you're sharing your own slides, and the floor is yours. Thanks for being here.
Thank you so much, Sarah. Thank you, Libby, for having me. Let me see if I can figure out this slide sharing thing. Does that look right? Can you all see?
Yep, looks good, Carrie.
Excellent, excellent. So as Sarah said, my name is Carrie Almasy. I'm the Director of Assessment and Planning at the Health Policy Institute of Ohio. I am a Lake County native, but I just moved back to Northeast Ohio in Cuyahoga County last fall. So I'm so happy to be here virtually among a bunch of fellow Northeast Ohioers, Northeastern Ohioans. And I also just want to share how impressed I am by all the work that I've seen from Healthy Northeast Ohio and all the updates that I've heard from you today. The data, the collaboration, the CHIP progress tracker alone, I'm super excited about. So I can't wait to dive into the work that you're doing more and learn more because it's incredibly impressive. And I hope that you're all really proud of the work that you're doing. So these are the objectives that I hope we will achieve together today. We're going to go over some of Ohio's greatest health challenges and strengths. I'll explain a bit about how disparities impact both health and economic outcomes in Ohio. And then sprinkled throughout, we'll provide quite a few different strategies that we can put in place to advance evidence-informed health policies and achieve equity. So HPIO is a nonprofit, nonpartisan, independent organization centered in Central Ohio, but with a focus on the state overall. And our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending here in Ohio. So before we get started, I'm going to ground us all to make sure we're all coming from the same place. So researchers have estimated that our health is influenced by many different factors. And while clinical care is important when we're sick, when we experience an accident or have a baby, we know that other factors play a larger role in making sure that we have what we need to be healthy. The majority of the factors that influence our health are related to our social, economic, and physical environments. Things like where we live and whether we have access to sufficient income and healthy food. The things that you see on the left half of the pie here, and I'm sure you all know this, are often what we refer to as the social drivers of health. We like to refer to them as drivers and not determinants because we don't see them as ultimately being determinative of health outcomes, but contributing to them. So before we get into our discussion, I'm going to be that person that asks us all to do a quick activity just to think about how these things impact ourselves in our own lives. So I'm going to ask you to think about a time when you did something for your own health and think about what either enabled or supported you to make that choice. So as you're thinking, you can either drop that in the chat or share with the group overall. I would love to hear from some of you. But I can share an example from my own life. So moving to Northeast Ohio, I used to live in an area of Columbus called Clintonville that didn't have any sidewalks where I lived, had very few streetlights, and just was not the easiest place for pedestrians to get around. There were several areas where there were recurring issues with pedestrians being hit by vehicles. So it was just not the most pedestrian friendly place to live. And that influenced my ability to be able to get out and walk with my family, to be able to go for runs. And so living where I do now, I live in a place with sidewalks, with street lights. I can walk to a grocery store where I can get fresh foods, and has really been able to support my ability to be healthy and active outside. Actually, I was just talking to Libby about how after we're done here today, I'm really hoping I can get outside and take advantage of the supposedly 65-degree weather that we're having today. So these are just some of the ways that I know that my environment has impacted my ability to choose to be healthy and active. So does anyone else have thoughts about things that have influenced their health over time?
I'm seeing a few
Carrie?
things
Oh, go
in the
ahead, sorry.
chat. So thanks everybody for participating. So people are sharing going for a run on lunch, doing water aerobics, yoga class, going to the gym.
3 times a week after having 2 children, bless you. That's amazing. So we know that the same things that are influencing our health are influencing the communities that we serve across Northeast Ohio. So what we want to summarize and take away from this is that access to care is necessary, but not sufficient to improve our health. And that social drivers can either support or inhibit our ability to make healthy choices and to access healthcare. But I also want to note that underlying all of this are the drivers of inequity, such as racism and discrimination, that can create barriers to good health and well-being. We also like to highlight that some of us experience more barriers to health than others, and that these barriers are rooted in policy. So, for example, decades of racist housing policies in the US, like redlining and racially restricted covenants, and even present day policies and practices like predatory lending, have resulted in neighborhood segregation, concentrated poverty, and disinvestment from communities of color. So, as a result, people of color are more likely to experience harmful community conditions, such as food deserts and unsafe and unstable housing that affect health and lead to health disparities over time. So today, I'm going to talk about Ohio's performance on a number of these factors and what we can do to improve health and health equity in our state. So going way back to 2014, HPIO created the first health value dashboard, which is a comprehensive assessment that includes over 100 metrics from publicly available sources, from a lot of the same sources that I heard you talking about earlier. The dashboard puts this data in context by comparing Ohio to other states, and then we also analyze whether Ohio as a state is improving or worsening over time. So what is health value? We all value things like having the opportunity to make our own health decisions, to be able to access affordable health care when we need it, to have income and resources that allow us to pay for our basic needs, and to have clean air to breathe and water to drink. But also, whether we're employers, taxpayers, or consumers, we can't afford to spend more on healthcare. So for all of these reasons, the Health Value Dashboard, which we produce every 2 years, includes data related to all of these different factors you see here. What we found for 2023 is that Ohio ranks 44th in terms of health value, which is near the bottom for all states. And after compiling 5 editions of the Health Value Dashboard, what we've seen is that Ohioans continue to live less healthy lives and spend more on healthcare than people in most other states. We are the only state other than West Virginia to rank in the bottom quartile on both population health and healthcare spending. So understanding what the data tells us is the first step, but we know that the next step is that we need to act. So action needs to happen in both the public and private sectors, at both the state and local level, meaning that there are roles for all of us to play. And one way that we can act is through public and private sector policy change. So today I'm going to describe 3 different categories of policies that can drive improvement, both in Ohio and across the country and in our local communities, strengthening the workforce, fostering mental well-being, and improving healthcare effectiveness. So I'm going to start with strengthening the workforce. I'll also share a couple of examples of evidence-informed policies that can lead to improvement in each of these categories. Because if you have ever looked at anything from HPIO or been to any of our previous forums, you know that we love a good evidence-informed recommendation. So what we have been seeing is that employers across the country have been struggling in recent years to fill open positions. So this led us to wonder to what extent poor health is contributing to these challenges and what we can do about it. So we analyzed publicly available data related to health trends and causes of death among working age Ohioans. What we found is that if the annual number of deaths had remained constant since 2007, nearly 67,000 fewer working age Ohioans would have died by 2022. In that same time, labor force participation declined by 5%, indicating that this is linked to health. So while we saw working age deaths among working age Ohioans increasing, we also saw labor force participation dropping at the same time. This chart explains why we are seeing more deaths among working age Ohioans. These are changes in the leading causes of death in Ohio among working age Ohioans from 2007 to 2022. So unintentional injuries, which includes overdose deaths and motor vehicle crashes, increased the most. The second highest rate of increase was associated with long-term alcohol overuse, which here is seen as chronic liver disease and cirrhosis. And we also saw large increases in deaths related to homicide and suicide. We know that many of these causes are connected to mental health, addiction, and violence. So in the dashboard, as I mentioned, we lift up a couple of examples of policies for which there's evidence of effectiveness for improving outcomes. So in terms of strengthening our workforce, things that we lifted up were strengthening the infrastructure for career technical education, increasing eligibility for childcare subsidies. Specifically in the state of Ohio, we recommended increasing eligibility to 200% of the federal poverty level. And then strengthening paid family leave benefits, both for public and private employees. We think that it's really important that new parents and family caregivers have the time that they need to be able to care for their families. Fostering mental well-being is the next area of focus. We're going to go over to improve health value. So Ohio, as you all know, has many challenges in this area, including our very high drug overdose death rate. You can see Ohio compared to US here on my screen. Overdose and suicide deaths are problems in all communities, but some counties in Ohio have been particularly hard hit. So when we look at Northeast Ohio, we can see that the areas along the lake and on the Pennsylvania border have been some of the most impacted in the state. We also know that some groups are more impacted than others. Among youth considering suicide, we know that those who are part of the LGBTQ plus community are almost 5 times higher than those who are not. We see a similar trend with youth suicide attempts in Ohio. But at the same time, it's interesting because access to healthcare is one of the areas where Ohio ranks highest. But despite the strength, there is still a great deal of unmet need, especially in terms of behavioral health. So the data we found saw that 1 in 4 Ohioans reported that they needed mental health treatment and did not receive it. So here are 3 areas where we can focus on improvement. The first is in building the behavioral health workforce, which I'm sure you all are very familiar with, through things like tuition reimbursement, loan repayment, paid internships, and pipeline training programs, especially those that are focused on underserved areas of our state. Another way would be through integrating mental and physical health through things like statewide implementation of certified community behavioral health clinics. And then we also know that there's always room to increase the supply and quality of recovery housing options. The third and final category we're going to focus on is healthcare effectiveness. And this includes things, the quality of healthcare we receive, and also includes the cost of care. The challenge here is that we have higher healthcare spending in Ohio than in most other states, as I mentioned before. So this is how we rank on a few high-level metrics. And as you can see, we are in the bottom quartile for all of them, which indicates that we have higher spending than other states. But the big question is if all of the spending is buying us better health. And unfortunately, the answer is no. So in fact, we are living shorter lives than people in most other states. We rank 38th among all states for life expectancy. On average, we lost a year and a half of life from 2018 to 2020. That's a year and a half less of time that we have to spend with our grandchildren or to enjoy retirement. You don't see it up on my screen, but we also see a similar and troubling trend with infant mortality, where the infant mortality rate increased in Ohio from 2021 to 2022 for the first time in about 20 years. But as I mentioned before, we do have strengths to build on here. We rank 8th, which is one of our best ranks in primary care access. This is the result of policy changes in Ohio over the past 2 administrations, including things like focus on patient-centered medical homes and Medicaid expansion. So we know that when policy is focused and evidence-informed, that we can see improvement. We also know that there's more work to be done in terms of connecting access to improved health outcomes and reduced healthcare spending, including things like supporting the Primary Care Workforce Initiative, which can build the capacity of FQHCs, extending the reach of school-based health services, and containing costs through things like cost growth benchmarks, which is really difficult for me to say, but it's an interesting concept I've been learning more about lately. One last thought on healthcare spending. So recent analysis from HPIO found that if Ohio was able to eliminate all racial disparities in income, health outcomes, and in incarceration, we would gain $79 billion in economic output each year. So if you're like me and you have a hard time wrapping your head around what $79 billion would mean, that's equivalent to 40% of our current state budget. So it's a huge amount of money we're talking about. In addition to that, we would be able to spend $3 billion less on healthcare per year. So there are both health and economic reasons for focusing on eliminating disparities in outcomes. And that's why I was so excited to hear so many of you talk about prioritizing equity. The dashboard quantifies these disparities in outcomes through what we call our equity profiles. This is the final area that I will cover today, where Ohio has real room for improvement. The dashboard includes equity profiles for Black Ohioans, Hispanic and Latino Ohioans, Ohioans with disabilities, Ohioans with lower incomes and or less education, and LGBTQ+ Ohioans. The profiles calculate the degree of inequity across a number of metrics. So for instance, we know that severe housing cost burden is 2.2 times higher for Black Ohioans than it is for white Ohioans. And severe housing cost burden is the percent of households with housing costs that are greater than 50% of their monthly income. When possible, the profiles also analyze the barriers that contribute to these inequities. So for instance, Black Ohioans are 10.3 times more likely to be treated worse in healthcare due to race than their white peers, and 6.1 times more likely to experience physical or emotional symptoms due to experiences of racism. Over time, these experiences of racism can take a toll on health and well-being. And combined with systemic inequities, this is why we see Black Americans living almost 6 years less than white Americans. We see a similar trend in Ohio, which is on the right half of my screen, where Black Ohioans are collectively losing thousands of years of life due to premature death before the age of 75. But I don't want to leave you without hope that we all can improve. There is a role for all of us in the public sector, in the private sector, as individuals, to take action to eliminate racism and discrimination and advance equity. Here are some examples of how we can take action. I'm going to point you to the last one here because it includes the work that you do to collectively work together to collect and report data and track progress over time. Because ultimately, we know that by advancing equity, we can improve health and economic prosperity across our region and across the state. So now I would love to hear, if you have any questions, if there's anything I can answer for you.
Thank you so much, Carrie. That was like such valuable information. We really appreciate you sharing it. I loved the focus on action. So I think we definitely have a few minutes for questions. So I would say, please feel free to add those to the chat if you'd like us to ask them to Carrie. I also think, as Libby shared, everyone should have the ability to come off mute. So please jump in.
I'll reshare too, because I have my contact information. If there are any questions about data, anything I shared today, please feel free to reach out. Would love to connect with you.
Hi, this is Andrea from Lorain County. Thank you, Carrie, for sharing your presentation with us. I was especially excited to see how one of the possible solutions to strengthen the workforce was paid family leave, especially since like being in the local health department world, like we're one of those offenders where we often don't offer paid family leave. And it's not just about walking the talk, right? It's also about like there are many employees here who are women of childbearing age, women of color, who we don't pay a lot. So maybe HPIO already has some tips or resources to help us prove to our boards or like with our boards, again, like all health department is all about the money. So does HPIO have anything coming down the pike that might help us with this issue? Or if not, like, please start one.
I don't know that we have an HPIO branded thing, but I could definitely point you towards like that. These are, like I said, these are all evidence informed policies. I can point you towards the evidence that we used that backs up our claim and like what outcomes you will see improved based on that evidence, et cetera. So I can share all of that background information with you. Our specific recommendation, I believe, was to include paid family leave to 12 weeks at a minimum. Oh, and also I wanted to mention, I heard an interesting phrase I hadn't heard before the other day, that what we're seeing right now is a lot of people in the workplace are considered a sandwich generation, meaning that they're both caring for their younger ones and they have caregiving responsibilities for maybe their parents or grandparents. So that's another reason why paid family leave is so important, because people are being hit with caregiving responsibilities from both sides. And that it's just such an important thing for their health, for the health of our workforce, for our communities.
Thank you.
Thank you. Thanks, Andrew, for that question. Does anyone else have a question for Carrie? Oh, go ahead, Carrie.
Oh yeah, I was also going to let you know, all of the stuff I shared today is available on our website. When I'm done sharing, I can drop some links in the chat, but it's also available. You can search and find the health value dashboard. Some of the things came from, we released a recent snapshot on working age death. I think I also mentioned data from our analysis on what Ohio could gain economically were we to eliminate racial disparities and inequities. So we have a whole publication on that. I also want to mention, since I heard so many of you talking about infant mortality, that we released a recent series of publication on taking action to reduce infant mortality in our state. So we have action guides on, and it's specifically focused on the drivers of infant mortality. So we have action guides on transportation, employment, housing, education, and racism, all in the context of infant mortality and things that folks across Ohio can do.
That's great. And if Libby and I didn't do it already, I think we have some of those slated to add to our resource library. So those are great resources for everyone. Okay. Awesome. Well, if there's no other questions for Carrie. Carrie, thank you again so much. We appreciate your time and expertise, and feel free to add any links in the chat, and maybe Libby and I can even include those in our follow-up. So Libby, I don't know if you want to pull the slides back up. Okay, I think we do this about every time, so bear with us, but just want to open the floor if you want to add any ideas you might have to the chat. We obviously want to make the content of these regional convenings meaningful and impactful for you. So if you have any ideas, whether it might be like a topic or a specific speaker, I was trying to take notes today of some of the challenges that it sounds like many of you are experiencing. So maybe that would be something that we could look into. But again, we'd like to get your feedback just to inform future agendas for our regional convenings. So any ideas you have, or even if you can't think of anything right now, please feel to always reach out to Libby and I via email. So I'll thank you in advance. And then Libby, I think I'm just going to turn things over to you to wrap us up.
Yes. Thank you, Sarah. And thanks again so much, Carrie. That was so great to have your presentation, and we really appreciate your time. And we're glad you could also be here for the partner sharing portion of the event. I think that was really important too for HPAO to know a little bit about what's going on in our Northeast Ohio region. So again, just really glad that you could take the time out of your day. So thanks so much. We are approaching our 3:30 stop time, so we do want to be respectful of everybody's time. Just a couple of reminders and a couple of items before we officially wrap up. So we do just have this friendly reminder about citing data from Healthy Northeast Ohio in reports or publications that you might have. And this is really helpful for us, just so that we know a little bit about how it's being utilized. It's really helpful for us for value propositions too. And again, we just thank you for in advance for doing that, and for those who have utilized and cited Healthy Northeast Ohio in your reports. And we'll leave our contact information up as always. I think most of you know how to get a hold of us. We did record today's event, so we will be circulating the webinar recording, and then a lot of the information that Carrie mentioned, we can include those attachments in our follow-up email, and we'll also include Carrie's slides too. So feel free to contact myself or Sarah with questions, and then like I said, we'll share Carrie's information as well.